Hi everyone, and very good evening to all of you. So I hope that you all are fine and in the best of their health, because most important right now is being healthy. Being healthy not in your physical health, but the mental health also is very important. So stay healthy, uh, stay bright, stay positive, and more importantly, spread positiveness. Right. Today evening we are here to understand the basic curriculum change, a big curriculum change that is all about the CBME. So what is CBME? Well, when I talked about CBME, a few of the students said, "C is a C confusion. What is C?" So C basically is nothing but it's a competency-based medical education. So I will talk a lot about the CBME. We'll talk a lot about this in the terms of what is the basic difference there, what has actually changed over the years, which told the government to come on change with a different way of approach. So initially, was it not CBME? Was it not at all competency based, or has just the name changed to competency based? What are the basic changes in terms of curriculum? What are the basic changes in terms of exam pattern? What are the basic changes in terms of the period or the tenure of individual year? So I'll be answering each and every of your doubts, queries, or maybe you don't have doubts and queries and you want to just know about it. So I'll try to take all of them also as the time progresses. So a very good evening to all of you for those who have joined. So please let's welcome each other by saying a good hi and hello. कैसे हो बच्चों? जितेंद्र वर्मा asking you, sir, CBME क्या होता है? Yes, a big question. That is all we are all about. CBME क्या होता है? क्यों होता है? इसकी जरूरत क्या हुई है ना? बेसिकली सबसे बड़ा तो क्वेश्चन ये है ना कि CBME की जरूरत थी या क्या नहीं थी? मतलब has does the name changed? It's a old wine and new bottle. What is it? So we'll talk about it a lot. So very good evening to all of you for those who have actually joined it right now. We are just about to start the session, but more importantly, let's say a bit hi and hello. For those who have joined it, please let me know in which year you are and what is your basic pattern of studying. Are you facing any difficulty in studying, so that I can guide you in a better way? This whole entire thing is basically for any student who has joined MBBS after 2019. Yes, the basic aim of today's lecture will be to cater to those children or those students who have joined the MBBS course 19 and onwards. So sir, if we are joining at 18, will it not affect us? So basically what they will do is, they means your medical colleges, they will try to they'll try to experiment everything on the 18 batch, so the 19 batch and onward batch is not make the scapegoat. So does it have any significance for those who are actually in the 18 batch? So I'll say yes, you surely have some importance of clinical significance. So it is important to you, for you also, to listen to the entire lecture altogether. But I'm just waiting for all of you. I'm just writing hi here in the comment box, and if you are there, please let me know how many of you are actually attending this lecture live, so that I can start with the basic, what is CBME, what is it all about, and the basic changes in what exactly has happened over the years. Right. So yes, Muhammad Uwais Khan, yes sir, I'm in first year, second batch of CBME. That's very good, Muhammad. I welcome you to my discussion today. What is CBME? This is the biggest thing. So remember, whatever I talk today, I'll talk from this. I've taken everything from the nmcorg.in. It's National Medical Commission, and anything that I say today is not my own thoughts. It is completely based. It's completely based on the guidelines given by the National Medical Commission, which is now has completely taken over from the Medical Council of India, the MCI. So whatever I talk today is not my own thoughts, is completely based on what the NMC is trying to guide us and where is it trying to tell you. So the first thing is, the NMC has been implemented from the August 2019. That is the MBBS batch starting in the first year. Please remember, anyone who is actually has passed first year. So suppose you have joined before August 2019, so this will not be directly affecting you. So this is only for those MBBS students who have joined 2019 August and onwards. So anyone who has joined before this will be continuing the same type of pattern, that is, should I say, non-competency based? So that's the biggest thing I'll now tell you, what is competency based and what is non-competency based. Okay, so what is it all about? A big question mark. Sir, kya hai pehle bata do. Now some big terms coming up. Number one, this will be very very interesting. It is called as Adcom. What is Adcom? So Adcom stands for here attitude, ethics and communication. Now, this I believe is a very good change. So yes, I do believe it's a very good change because uh, what has happened over the years is we all have trying to become a good doctors, and in that attempt to become a good doctors, we are just reading textbooks and books and clinical cases. But what we have forgotten is how to talk to a patient, how to communicate to a patient, what should be our attitude, and what should we think about the patient. Because ultimately we are all becoming doctors for a patient, right? So when we say Adcom, it means what is our attitude not only towards the patient, but attitudes towards each other, attitude towards a teacher, attitude towards the faculty, and attitude most importantly towards the patient. Secondly, ethics. So are we following the right ethics? Is the entire thing that we are doing right now, that means the preparation, the studies, are they actually belonging to the ethics that has been taught to us, the Hippocratic oath? So how do we remember that? So we just take the Hippocratic oath as we join MBBS, and we most probably, like let me talk about myself, we forget about it. Even many of us are not actually attending the first day of MBBS, so we are just not able to remember what the Hippocratic oath is all about. Communication. So suppose the patient comes to you, you have to communicate him quite well. You have to communicate him about his disease, about the prognosis, about what is your treatment program. And let's assume a patient says that he wants to get a second opinion from other doctor. Should you get angry? That is all about the communication skill that you are actually going to get. It is called as Adcom. So this first of all telling you what I'll be discussing today. We'll talk about the foundation course. We'll talk about the early clinical exposure. And this is the next one, that is competency-based medical education that has now come up. Okay, the few other things we'll talk about. I'll take it one by one, starting with the first one. Let's talk about what is Adcom. There you go. So what has happened, I told you that most of the medical students, as either falling into the medicine, they actually are in so much hurry about learning so much of anatomy, biochemistry, and physiology that they are not giving adequate amount of time to learn the ethics, to learn the attitude and the communication skill that they should have for the patient. See, your communication with the patient is one of the most important thing that will make you successful in life. So you become a doctor, it will not only depend upon your knowledge, but will surely depend upon your skills and attitudes and responsiveness to the patient. So what they have tried to do is, the Adcom will not be done only in the first year. The Adcom is divided into multiple modules and has been put into year 1 of professional career, that is Prof 1, Prof 2, Prof 3, Part 1, Prof 3, Part 2. So that means the Adcom has been divided completely into 4 parts. Please remember, this Adcom, it has now been divided into 4 parts, and the 4 parts, you can say either 4 parts or you can say 4 modules. And the 4 modules is divided into each of the first Prof, second Prof, third Prof, Part 1, and third Prof, Part 2. That is what they have done. They have divided the entire modules into 4 parts. So what they will tell you is, for example, if you're in first year, the day you enter a medical college, you're completely wavered. What has happened? So where is the anatomy hall? Where is the physiology hall? Where is the biochemistry hall? Where is the medicine lecture? Where is the surgical discipline? Where is the a place to play? Where is the place to move out? Where is the place to sit? Canteen kahan hai ye sab? So all of them is also a part of Adcom now. So Adcom is not only about just teaching you how to face a patient, how to communicate with the patient. It's also about teaching or telling you that what you should do and where are all the things in your medical colleges. I completely agree. This is also done nowadays. It's not that it's not a part of the medical curriculum. Any medical college on day 1 will always orient a student. So this will also include a strong orientation from your principal. I hope you remember the Munna Bhai MBBS wala, on which the day 1 pe, he comes and tells you and tells everyone, oh, that you are now becoming a doctor. That type of motivation is required by the principal on day 1 to motivate everyone. That actually is Adcom. But Adcom is not only in the first year. So what they have done is, so when you move in the first year, you will talk about who you are. What is the advantage of becoming a doctor? A responsibility of doctor to the patient. So in the second year, the Adcom will all depend or actually tell you that what are the basic tests or principles of the tests that you must be doing. In Adcom, in third Prof Part 1, they're talking about what the communication skill to the patients, because now you're going to the wards and you can communicate in a better way. So that is Adcom in the third Prof Part 1. In the Adcom third Prof Part 2, they'll talk about the prognosis. That will you have to explain to the patient that suppose I do this surgery, the risks are these, the side effects are these, and maybe if I treat this, the following things out of your features will not be improving. So that is actually about in the third prof part 2. So Adcom will be divided completely into the first prof, second prof, and all those things. That is very, very important. Okay. So also remember, okay, apart from this, let's talk about the foundation course. So the second thing they have introduced now is actually a foundation course. So what is foundation course? See, what they have now done is, when you enter a medical college, again you have to get, it is a dedicated 1 year of exclusive foundation course at the beginning of the MBBS course to orient and sensitize the students to the various fields of the medicine. So this is actually the start of the first month, and therefore you'll see the entire curriculum of the MBBS has now changed from 12 months to 12 plus 1, that is the 13 months. I'll talk about this in the upcoming slides. So it is all about the foundation course, which is talked about the National Medical Council nowadays. Okay. In the foundation, what they've done is they've divided the total teaching hours into 175 hours. Please remember, all the contents I'm talking about right now is taken from the National Medical Council nmc.org.in. Okay. So see, the first 30 hours will be orientation. Orientation means who you are now. You are going to become a doctor, who your faculties are, where is the canteen and all those. Then there is a skill module, a field visit to the community health center is one of the things that they can do it. Okay. Then there is a professional development, including ethics. Okay. There's ethical development that I talked about. There is a sports and extracurricular activities in the first year, very important part. Obviously you have studied so much and entered the MBBS. Now you should have some fun, right? So it's the sports also, and there is also an enhancement of the language and the computer skills. This all will include a 175 teaching hours, and they would be done completely in the first month of your entry into medical colleges. Okay, this is called as foundation course. So one was Adcom divided into the complete MBBS course, then comes the foundation course, and there has also been a big change here. The third thing that the NMC talks about is the early clinical exposure. So what does it mean? So if you understand, the clinical exposure to any MBBS student is mostly done in the second year and onwards. But now what they have proposed is, they call it ECE. Okay, early clinical exposure, they call it ECE. The ECE should be done in the first year as well. So how to incorporate the first year clinical exposure is that you're going to the wards and seeing which patients are getting admitted to the wards. Make a list out of it, and out of the list, to see your own textbooks of anatomy, biochemistry, and physiology to understand that what are the basic diseases you have to read and study in the textbooks. Okay, that's one thing you can learn while you're going to the clinics in the first year as well. Okay. Secondly, while you're in second year, or you are just entering the second year, or maybe also in the first year, you'll be given some clinical cases. So the early clinical exposure, called as ECE, it has to be done in the first year as well. Okay, in the first year as well, according to the basic rules, guidelines rules, the GMR rules up to 19. Now that is 90 hours, has to be equally given into all three subjects. So for every subject, you will be giving 30 hours each for anatomy, 30 hours for biochemistry, and 30 hours of physiology as the clinical exposure. So how to explain yourself? So you go to the surgical wards in first year and you see a patient of varicose vein. That varicose vein should tell you that what is the anatomy of the venous system. So where are the valves situated, right? And what is the basic reason of varicosity? Because of the abnormal valves there. So you can just look at the anatomical knowledge looking at those findings. Suppose you go to the surgical wards and you see a patient supposedly of acute appendicitis. So you come back and you read in your anatomical textbooks what is the structure of appendix. It's a vestigial organ, agreed, but what is the histology of appendix? So appendix has a type of histology which is very unique to the appendix, that means like Gemina centers. So now you are coming back, you can understand that appendix inflammation is called as acute appendicitis. And when you go to the patient and ask him that what is the complaint, he tells you, I have acute pain abdomen in the lower right abdomen. So that's what you correlate from the first year to actually the final year, that is actually called as early clinical exposure, starting not in the second year, but from the first year itself. It's called as early clinical exposure. Let's see an example of what I'm talking about. Dekho. I'm reading this case for you. This case is also given in the nmc.org.in. I have not changed it so that you can also read it from there. So this patient is a 48-year-old company executive, and what has happened is he has experienced a sudden crushing chest pain. Okay. Now he returned from his morning walk, and his wife noticed that he was pale, he was sweating profusely, and he was in distress. She rushed him to the ICU of a nearby hospital immediately. Now, you see, this case is very correlating to what you might often come across in your regular day-to-day life. She rushed him to the ICU of a nearby hospital. She told that the attending physician that on the previous occasion he too had felt some pain, but it had subsided with rest. But now, because he's a smoker, he's having a pain and has not subsided with the rest. So what to do? He suffers with diabetes, dyslipidemia, hypertension, and his ECG was showing a ST elevation in the lead 2, lead 3, and the AVF lead. Now he was admitted to the ICU. So if you look at his history, this history will be given to you in the first year only. So in the first year, you will talk about that what is this all about. So what are the features we should talk about that the problem is there in the patient. So you will see, you'll read in first year that the patient is having pale. So what is pale? He becomes almost white color. He is sweating a lot because of sympathetic stimulation, which you read in physiology, right? He was in distress. Respiratory distress can often happen if the blood circulation is not happening well in the heart. Now, you will also read that if the patient is diabetic, dyslipidemia, and hypertension, so these three things you'll read in the topic of biochemistry. You read about diabetes, you read about the effect of diabetes in the various systems, and you look about the dyslipidemia. Well, all this case will tell you it can be a case of a myocardial infarction. So in the first year, what you can look into is what is the probable reason of the severe pain. Now, this will be taught actually in the topic of physiology in the cardiovascular system. What are the ways regulatory mechanisms to feel the increased demand of oxygen? So you read about Frank's starting law, which is actually a law based on the increased stretch and again more and more contraction force, which is equally proportional. So how are diabetes, hypertension, and ischemia correlating? This will read in biochemistry that when the patient has diabetes, what happens is veins get laxed, and the veins have deposition of a proteoglycan inside it. So that proteoglycan, what it does is it decreases the lumen diameter of the veins or arteries, and that is why the patient may have a myocardial infarction. Same thing also goes for hypertension because it damages the vessels. The vessels become more and more atherosclerotic, and the same thing will also decrease the lumen diameter, ultimately causing the myocardial ischemia. So what does change in ECG indicate? This will also be taught in the physiology in the first year in the topic of cardiovascular system, in which you read about the ECG completely altogether. But this is not it. After this, in the first year as well, you will given the various cardiac markers. So the cardiac markers is short a topic which you read in biochemistry. You talk about the troponin, TROP-I, TROP-T, and the cholesterol level. Talk about the LDL, HDL, and the triglycerides. These all are talked. Everything is talked about in the biochemistry. So in the biochemistry, when you read all this, so it is not only about knowing what is the cholesterol, what is the pathway of cholesterol mechanism, what is the reverse cholesterol. It's not only about that. It's also about knowing the role of cholesterol and how does the cholesterol correlates to the risk of myocardial infarction in terms of dyslipidemia or hyperlipidemia or whatever it is. So it is, please understand that now when you read a topic of biochemistry, please correlate this to other things. For example, let's give you an example. You read a carbohydrate metabolism. So in the carbohydrate metabolism, please know the essential criteria of diagnosing the diabetes. Okay, please know about the glycogen storage diseases. Please understand the basic pathophysiology of the diabetic ketoacidosis. Please know the difference of DKA versus a hyperosmolar non-ketotic coma. So this honk versus DKA are so much thing that you know in the diabetes. This all will be very, very important as you actually are moving into the same. Okay, so it is not only about the topic nowadays, it's also about correlating one thing to other, which is what is actually called as competency-based medical education. Competency-based medical education. Okay. Acha. Apart from this, what else it is? See, so you know, when you move to second year, you'll talk about the cardiac biomarkers. You have to then know in the topic of cardiac system that what is the level of lipid level, increased level of lipid levels indicate, and how does hyperlipidemia actually cause something that how does a level of hyperlipidemia they actually cause sorry Yes. So how does the level of hyperlipidemia? It actually leads to increased level of atherosclerosis or myocardial infarction. So all of these are very, very important to know nowadays. Okay. Acha. Now, when you move to the final year, so this is about the final year. Now, this will be done in the, these all things will be done in sitting in your own classes. So it will be clinical based questions nowadays. But this will be done in the OPDs. So this, the site of this would be a OPD of the final year. That is, you can go to the cardiovascular OPD and you can look into what is happening there. So demonstrate knowledge of process of counseling and communicating to the patients. With empathy, the dietary modification he would require to move out of the risk of myocardial infarction. So when you move to the OPD, you will see that your faculty of the final year of medicine or cardiology, he's advising the patients to either stop smoking. He would tell him to avoid oily food, just walk around a bit of brisk walk of 30 minutes. So all this lifestyle modification is now a part of the treatment and prognostic program. So that is what will be taught in the final year of the same case moving forward into the final year. But when you should learn it, you should learn when you go to the OPDs right in from the first year or maybe in the starting of the second year. Okay. So now the biggest thing, sir, if so many things are happening, has the exam pattern changed? So yes, it has changed a bit. So what they are now proposing is, apart from written tests that they will be giving, they surely will be essay based question. There's no doubt about it. The essay based question is there to be, it will not go out. Okay. There will be short notes and there will be creative writing experiences. Okay. Apart from this, there will be practical, clinical, internal assessment as well. In the practical, it can be a OSCE based. So this is very important. What is OSCE? So OSCE is something called as objective structured clinical examination. So what they do is, for example, I showed you this case, right? So when I read this case, from this case, the faculty can take you anywhere. He can take you to hypertension. He can take you to dyslipidemia. He can take you to the questions to the diabetes. So he can take you everywhere or anywhere he wants to. That is called as OSCE. Okay. So OSCE is actually type of table, and in that table there is a case given there. You pick up the case, you read it, and then you're asked multiple questions. It becomes a part of the objective structured clinical examination. The OSCE is a very, very good tool to assess and teach a medical student. There can be practical examination, which is called as OSPE. There can be directly observed procedural skills that you're doing a test, and they can observe you, right? And there can be mini clinical evaluation exercises. They'll also tell you how to maintain the records, maintenance, and an attitudinal assessment. Well, now comes a very important part, that sir, so many things are happening, but do we need to actually do it? What if we don't do it? Well, there should be a logbook. Now this logbook is a new introduction to the medical students now. The logbook should record every activities, like a seminar that you have taken, symposium, quizzes, or any academic activities that you actually are a part of. So if you have achieved anything, it will also be recorded in the logbook. If there is an assessment and you have not submitted, that also will be in the logbook. And not to forget that the 20% of the internal assessment should be from the logbook assessment. So maintaining logbook and getting a proper good logbook is very, very important now for you. If you're actually going for the CBME, not going for, you have to go for CBME. There's no choice about it. There's one thing. Okay. Now what is the component of exam? So exams will have a written test. As I told you, it can be short notes, it can be creative experiences, it can be a long essay based questions, and surely can be an OSCE based clinical examination questions. What is the exam schedule? Now this again becomes very important. So what is the exam schedule? So what is the biggest change that you've seen? The biggest change now in the CBME. So what is happening is, the first month I told you is completely foundation course. Now this is the 1 month. It's 1 month. Okay. The first month of August is actually 1 month. It's completely a foundation course. September, October, November, that means the complete 12 months here. Now if you add this thing, it becomes 13 months. So the 13 months is actually for the first year. The 13 months is actually of the first year. Now, this 12 months is for the second year. Remember, previously the second year used to be of actually 1.5 years. But now they have reduced the second year by a fraction of 6 months. And the 6 months is now given where? Let's see that. Now what they've done is, the third year MBBS is again of completely 13 months. Completely of 13 months. And the final year here is completely of 15 months now. So what they've put is they've taken the second year out, 6 months out from here and given to the final year. Well, the forensic medicine FM, the forensic medicine has been taken from the second MBBS and has put to the third year MBBS part 1. Third year MBBS part 1. Okay. And after this examination of the third prof part 2, you now move to the internship, and after completing internship, you can then actually move forward to clinic practice it. Now, what has now changed a bit is the next one and next two. You're already aware of it, even though I'm not talking about next one, next two now. But yes, there would be a next one exam here. I'll just write it here. So now you have to appear for the next one exam here. This exam is actually next one. Okay, next one. So next one will surely take into account your logbook activities, your internal assessment, all of them will be going to the next one activity. And when you complete the internship, you then appear for the next two, and then you do a clinical practice. So you can only do the clinical practice if you have passed the next two exam. So if you are not able to pass the next one exam, you are failing it here, you again have to appear for next one. You cannot go for doing a next two exam. Okay, but if you have passed the next one and you now appear for next two, in next two you have failed, then you again have to appear for the next two only. Okay, now this score of next one will be taken into account for giving you a rank of the PG Medical College that you actually are eligible for. Achha. Now the paper assessment is also the same. There's nothing more difference here. The first prof has anatomy, physiology, biochemistry. Second prof has pharma, path and microbiology. As I told you, the forensic medicine has been removed from here. The third has the ophtha, ENT, computer medicine, and the forensic medicine has moved here from the second prof as come to the third prof part 1. And the third prof, the general medicine, general surgery, pediatrics, and obs gynae, the 4 papers. And to add to this one, these 4, there are other 5 subjects which you, if you know, it is all about the psychiatry. There is radiology, there is anesthesia, there is dermatology, and there is amount of radiology as well. Well, how will the exam be conducted? So exam will have long questions, short questions, and objective type questions. But if there is an objective type questions, the MCQ will not be more than 20%. That means the number of MCQs that you will be given in your exams will be actually less than 20%. So don't be in a way that you will only be given MCQs. It's a wrong concept. According to the CBME, you will be given long questions, you will be given short questions, objective type questions, multiple choice questions, and also you will be given a MCQ which will be a part of the syllabus of exams, but will be less than 20% of the entire questions that will be asked for. Okay, now comes how will the question be framed. So in the question framing, they have now seen the levels. For example, if the question is testing your knowledge, the question will have the terms like define. For example, define hyperlipidemia, or describe. For example, describe the steps of carbohydrate metabolism, or draw the carbohydrate metabolism figure, or find or enumerate, cite, and all these will come under the topic of knowledge. So every paper that is set for you will have a component of knowledge, comprehension, how much you have understood that topic. So you will need to discuss that. So like for example, discuss the carbohydrate metabolism in brief. So now you write it more than definition. The definition means the single line. The discussion means you have to write the complete change of carbohydrate metabolism, right from the glycolysis, the neoglucogenesis, the glycogenolysis, the glycogenesis, and all of those should go into discussion. Conclude or articulate, all these terms can be used. Mostly the medical questions are based on this topic of discuss or interpret and review or summarize. Application. So if you read a topic, for example, read the topic of carbohydrate metabolism, and now you have to know, I read also about diabetes. Then comes the application part. So apply, choose, compute, modify, all those terms will come under the application part. Analysis, synthesis, and evaluation will be the other types of questions that you can get in your main examination paper. So all of these can be given as a question in your main exam pattern. Now comes the question, sir, again the practical. I think I already talked about the practicals. I'll just skip it. Okay. Now see the third prof MBBS. So this becomes again very important. I just taken third prof because it has changed a bit. Third prof part 1 exam should be held at the third prof part 1 of training 12 months in the subjects of the IENT PSM, and obviously the forensic medicine. The third professional part 2, the final prof examination, shall be done at the end of the training. Okay, 14 months including the 2 months of electives. What is electives? in the subjects of medicine, surgery, gynae, obs, pediatrics, and apart from this, the disciplines of orthopedics, anesthesia, dentistry, radiology will constitute 25% of total theory marks incorporated in separate section of the paper 2 of general surgery. Okay, if you look at the medicine, so in medicine you get questions from psychiatry, dermatology and obviously the DVA, that is venereology and leprosy. Respiratory medicine, including tuberculosis, will constitute 25% of the total general medicine marks. So 25% of GS will come from the topic correlating to surgery, and 25% questions of medicine will come from the psychiatry, dermatology, respiratory, and all of this will come as 25% questions in the general medicine as well. Achha. So now I think we have talked a lot about the human anatomy, pathology, and all these questions. Now what they have done, a big change, how to pass it. Yes, so how to pass these exams. So in the paper that have two papers, if there's a two paper, that means which two papers? See here, I talked about these papers. There was a paper 1, so it is only one paper. Ophtha, one paper. ENT, one paper. But ComMed has two paper. If you look at your first year, then in the first year there is anatomy 2 paper, physiology 2 paper, and biochemistry 2 papers. So if you get, see, the passing criteria is 50% combined in theory and practicals. So if you combine both of them, you'll get at least 50%, and individually in the two papers, you'll get 40 and 40% individually in every paper. Okay, that is how you pass the exam. Else, I will not say that, but yes, you have to apply for supplementary. And one more thing that they've done is the supplementary exam must happen within 3 months, 90 days of the first paper that has happened. Okay, this is also a big change in the CBME, that after you have given your paper of any prop exams, and God forbid, but if you fail there, then you have to appear for the supplementary exam, and the supplementary exam should happen within 90 days of the initial exams. Okay, so very interesting things also come up. Now, one thing I have just read in CBME was, if you have joined it in supposing 2020, the maximum tenure can be given, you can be given to complete a complete MBBS is 10 years. That means somehow if you just leave MBBS in between and you again come back to do the MBBS, you will be given 10 years from the state of joining. Suppose you have joined at 2020, so you have to pass MBBS completely by 2030. Else, if you pass in 2032, it will not be taken into account, and you again have to reappear for the MBBS exam. But I don't think that's a very easy way or at all simple way to do that. Okay, now comes the very important part of CBME, and I believe this is what CBME is all about. So look at this. What CBME has done is they've divided the entire subjects of the entire MBBS curriculum into not the I'll say chapters, but the topics. Every topic will have some outcomes. So what is the topic? What is the outcome? Let me take an example of anatomy. So in anatomy, the broad specialty is intestine, like GIT or abdomen. In the abdomen, a small specialty or a topic would be supposedly large intestine, and that topic becomes large intestine. In the large intestine, if you talk about malrotation, that malrotation becomes the outcome of large intestine. Okay, I'll take one more example. In anatomy, suppose you read about a caudate lobe of liver. So caudate lobe of liver will become the topic. The outcome can be many. It can be surgical lobe of liver. It can be how to excise the liver, how to cut the liver. So all those will become a part of the outcome. So topic is something which is you're reading a textbook, and outcome means what you should know from those things. Let me give an example in a better way. They're given topics and outcome for all subjects, like everything that you know is given as the outcome there. Okay, these all are the topics and the outcome. So if you look at the topics, the most important, you cannot take it out from this, because what they've done is the maximum number of topics they're given for. If you look at here, the maximum number of topics, you'll be surprised to see it is actually an anatomy, and after that anatomy, the last number of topic has been given to actually pediatrics, which is actually nothing less than 35 topics and 406 outcomes. The 406 outcome is very high. So you cannot completely correlate, but that means the pediatrics has actually become very important from the CBME based pattern. Okay? Achha. Now see, let's talk about the competency based medical education a bit more. What is CBME? CBME talks about when you read a topic, please remember, if you read a topic, what you should know about it. Whether you should only know about it, so you know, or you know how. What is know how? Know means you just read it. And know how means when you read it, you can also explain to someone else. You can discuss or analyze it. Then comes shows. That means, are you able to identify or demonstrate? Or you are identified and demonstrate and know everything about the steps involved in that. Or you can also perform it. You can also perform it. Okay, so there is a mastery of the level of competence. For example, if I ask you to do a glucose estimation urine, so you know the theory. For glucose estimation, there is a GOD, POD method, glucose oxidase and peroxidase method. Well, do you know the principle of it? If you know, it becomes knows how. Show. Do you know the steps of it? That means you take a Benedict solution, you drop 5 ml, 5 drops of urine there, and you then heat it. That is shows. Show how. Now, can you do it? Yes, you can. Then becomes show how. And perform means you know everything about it, and not only everything about it, when the color comes out to be in a different colors, can you actually grade the different color to different amount of glucose in urine? It becomes performs. So there are 5 things that I have told you. It is K for knows, K, H means knows how, S means shows, SH means shows how, and P means perform. So based on that, they have made something like this one. Now this is one of the most important final thing I'll talk about. What is a competency-based medical education is all about. The CBME has divided the entire medical curriculum into topics, and every topic has a table out of it. If you open the CBME platform, you will get volume 1, volume 2, and volume 3. In the volume 1, they have put the first year subjects as second year subjects. In volume 2, they have put the second and third year subjects. In volume 3, they have put the completely final year subjects. So look at an example. This is the A. A means number. Number में the PY means physiology 1.1, or IM means internal medicine. This IM becomes internal medicine, and the 5.4 becomes the number from which they have been taken. So competency means what is the topic. For example, in the internal medicine, the topic is elicit, document, and present a medical history that helps delineate the what is the topic is being called as competency. Now, how to learn the competency is here. Domain. Domain means whether it is a knowledge based, it's skill based, it's attitude, or it's communication. That means, suppose I talk about diabetes. So in the diabetes, you should know about it. Now, should you be able to practice it? Yes, you must also be able to practice it. That becomes skills. It becomes skill. Attitude. Now, should you be able to explain the patient? Yes, that's attitude. And communication. So when you explain the patient that you have diabetes, now can you tell the prognosis? Yes, that becomes knowledge also, skill also, attitude also, and also communication. Then comes the D column, which talks about whether it is know how or show how. I told you K is know, KH is know how, S is shows, SH is show how, and the last one becomes perform, P. So this topic will become supposedly SH, with the show how, or this one is know how. So the two different things being shown here. Then comes a core. Core means whether you should read this topic in detail or not. Something is which you must know, and something is which you may know in small amount of detail. So if it is a very important topic of your field, it comes into core. Okay, that means core means you have to read it. And if it is written N here, it means desirable to know, but not necessary to know. Desirable, but not necessary. Now, what you must do is, while you're reading any topic of your MBBS, look into this table, which is quite available in the nmc.org.in into volume 1, volume 2, volume 3. See whether it is yes or no. If it is yes, please read it in detail. If N, you may skip it. It will really make your life very easier. So I think the best part of NMC is this, because we have been telling you a lot of things that the day you understand what you have not to read, you will become the master. And NMC has told you what not to read. It becomes the no, N. Then comes suggested reading and teaching module. So how to read it? Whether it should be done in lectures, or small group discussions, or it's a bedside cleaning. How you should teach that things. So this is obviously for the faculty in your medical colleges. Now, when they've taught it, they should take an exam. So how to take an exam? That is the suggested assessment method, whether written or viva, or it should be done by written exams. And then, is this not required to certify? That is P. Matlab, number of times a skill needs to be done independently to be certified or perform. That means, this means whether you should be able to perform or not. For an MBBS candidate, you are not expected to perform that independently. You are expected to know about it, show and show how. The P component is often not expected for a medical graduate. Okay, and then comes vertical integration. Now this is again a very important point. So when you're reading a topic, that topic is supposedly in physiology. Let's take a topic of physiology as a cardiovascular system, and in the cardiovascular system you're talking about supposedly ejection fraction. So ejection fraction is a topic of physiology. If the ejection fraction decreases, it becomes pathology, congestive cardiac failure. Now, when the reading on the ejection fraction decreasing and the patient has become congestive cardiac failure, you read about the drugs called as digitalis. It becomes pharmacology. It becomes what? All becomes vertical integration. Now, when you read about the prognosis, it becomes medicine. It again becomes vertical integration. Similarly, there's something called as horizontal integration. For example, supposedly you're reading about, let's take an example of a glucose metabolism in biochemistry. The glucose metabolism in biochemistry, you will also read about the definition of diabetes. You can also read about the difference of DK and HONC in biochemistry. That becomes a horizontal integration. That means the same subject being correlated to the same subject from some other chapter or some other area. It becomes horizontal integration. So whatever topic, excuse me. So whatever topic you're reading, every topic has been divided into some topics which are vertically integrated and some topics which are horizontally integrated. And every topic of the NMC has been given in the same form of this table. It's a very important table, and I think this is what has defined the completely CBME. So competency-based medical education is all about this table, and this table you can find in the complete nmc.org.in, given in volume 1, volume 2 and volume 3. And I believe this is one of the most important change that they have done in a medical education. Please understand, it's not only about reading a topic, it's about knowing the integration of the topic. You read about supposedly a neutrophil in biochemistry or in physiology, neutrophil functions in physiology, but neutrophil dysfunction in pathology. How to treat that in medicine. So all these are vertical integration. So you are not so much, independently knowing that what to read from other subjects. But this table will tell you, if you have read this from medicine, now go back in your pathology or biochemistry or anatomy, come back there and see that. So just to tell you, I'll just show an example of what they have done it and how they have done it. There go. See, suppose there is a topic of identify the etiology of meningitis based on the CSF finding. So what is this? It's a knowledge and skill. KNS means knowledge and skill. SH means you have to show, and SH means show how. That means you have to know the parameters of the CSF. You have to know what is the importance of the findings of CSF, for example, the protein, glucose, and the chloride levels. And then you should know, yes, it's a core finding, in core thing that you must know everything about the CSF findings in the topic that you're reading. Okay. Similarly, if we talk about the identify the etiology of meningitis on the given CSF parameters, again it becomes a knowledge and skill. Okay, show how means you have to know in and out of it, and yes, it becomes a core topic what you must read. So after you have read this topic, you must be able to answer these questions. What are those? See, it is what? It was knowledge and skill. That means you must be able to enumerate 5 causes of meningitis prevalent in India. You should be able to test the CSF for its various components. Short notes can be given in any part. Describe CSF findings characteristic of tubercular meningitis. And you must be able to know the skill set, that means review CSF findings in the following patients and whether you're able to diagnose the etiology based on the findings of CSF. For example, it is given the sugar is low, the protein is very high, and chloride is also very low. The patient has cobweb coagulant being formed in the CSF. It becomes what? It becomes a case of tubercular meningitis. So once you see there's K by S, so K by S means now you have to know everything about the same. Everything about the same. It becomes K by S means knowledge भी है, skill भी है. S मतलब SH means show how है. The P is always not there, usually not required for you. And Y means yes, yes, yes. It's a core field of your medical curriculum. Okay, so it's all about this NMC bringing you the competency based medical education, and I believe that it's a good change because ultimately while you become a doctor you should be able to understand the needs of a patient, needs of society, and yes, you must be competent enough to practice medicine in India. So CBME is a very, very good thing. It will really, I'll not say it has changed a lot of medical education because already the things were being done so. But what it does actually, I'll tell you my own findings now. What it does actually is basically it tries to, equate every medical college in India. So whether you are doing your MBS from AIMS Delhi or MAMC or UCMS, or you're doing it from any private medical college, the teaching pattern becomes similar because everyone will not have to be taught about this topic in the K by S phenomenon, and yes, it becomes a core topic. So it brings the similarities and uniformity in teaching everywhere in India. And I believe it's a welcome change because ultimately, whether you did an MBBS from, the quality of teaching should not at all suffer anywhere. Okay, so the faculties of that medical college now know what to teach, up to what to teach, and what you may just skip in your MBBS career or in your MBBS time. So I really believe that this CBME is a very welcome step. Well, I'll open this entire thing for your doubts and your suggestions and what do you feel about this, because ultimately whatever has been done and we have to find something good about it. So the good about thing is, number one, I believe number one, it is that the medical education becomes uniform throughout the medical colleges. Number two, the teaching stand becomes improved in the private medical colleges. Well, I hope so. Number three, that now the topics are very much clear and you also know which topic to collate from which subject to which subject. And number four, thankfully the second year has been reduced to the just a matter of 12 months, because that 6 months is more than sufficient to be added in the final subjects in which you have more than 4 or 5 subjects to deal about it. Okay. So that is all about what I want to tell you. It's all about the CBME. I hope, I wish you all the best in your medical career. Waiting for all your feedbacks into whether I was able to communicate you well or not. What is CBME? And I think that I've shown to you everything about the CBME, whether it is in the NMC or it's not in the NMC, based on my own observations also. So I thank you all for staying with me. Wishing you all the best. Waiting for your valuable feedbacks and comments in the upcoming days or times to see. And wishing all the best. Most importantly, study well. Don't be afraid of what is this CBME. It's very, very simple. Now you know what to read and you also know what not to read. That is very important in becoming a good doctor. You know how to communicate with the patient. You get that skill. You get that communication skill, and will really, really make you a very good clinician in your medical society. Okay, so take care. God bless you all, and see you all. If you have any doubts or comments, please put in the comment box below. I'm still available for discussing it right now. Else, we'll just stop the session. Okay. Please put your questions that if you have any. So I believe that I have actually been able to solve most of the doubts and questions around CBME. I've discussed you everything, right from the foundation course to at the Adcom. I discussed with you the competency based medical education. I talked about the volume 1, volume 2, volume 3. I've talked about integration modules. I talked about the competency based assessment modules in terms of the logbook that you're going to create. So everything I've talked about, and I hope that this was a quite a fruitful lecture. Okay, so wishing you all the best. Take care. God bless you all, and have a good night to all of you. Bye bye.